Diabetes around the world. Diabetes is known as the fastest growing chronic condition in the world. Here are some facts according to the International Diabetes Federation.
1 in 11 adults have diabetes from age 20 to 79 years old.
That's approximately 463 million worldwide. 1 in 2 adults with diabetes is undiagnosed. Approximately 232 million globally. 1 in 5 people with diabetes is above 65 years old. That is approximately 136 million people. 10% of the global health expenditure is spent on diabetes. That's around $760 billion US. Diabetes caused 4.2 million deaths. 3 in 4 people with diabetes live in low and middle income countries. An estimated 310 million or 2 in 3 adults with diabetes live in urban areas. What is hemoglobin A1C and how does the HbA1c test work? HbA1c is glucose-attached hemoglobin on red blood cells. The HbA1c test primarily measures A1c to determine the 3-month average blood sugar level, and can be used as a diagnostic test for diabetes mellitus, and as an assessment test for glycemic control in diabetics. With this method of testing, fasting is not required and blood can be drawn for the test at any time of the day. The concentration of HbA1c is directly proportional to the levels of glucose in the past 2 to 3 months. The HbA1c test helps diagnose type 2 diabetes and prediabetes.
It also helps monitor blood glucose levels in people with type 1 and type 2 diabetes.
TOSO GHB analyzers, the GX, G8, and G11 can accept the diverse type of anticoagulant blood tubes.
In 2011, World Health Organization recommended the use of HbA1c for the diagnosis of diabetes mellitus. World Health Organization also recommended an HbA1c of 6.5%. NGSB is used as a cutoff point for diagnosing diabetes. This graph shows that as the A1c concentration increases in the body without intervention, the greater or higher the chance the person will have complications resulting in a higher glucose level in the blood. A value greater than 6.5% is at risk of diabetes complications such as cardiovascular disease, kidney damage or nephropathy, eye damage or retinopathy, peripheral artery disease, nerve damage or neuropathy. A large clinical trial conducted by DCCT and UKPDS using the HbA1c test led to a reduction of complications of diabetes. The international HbA1c targets require that all HbA1c methods are precise, and have minimal standardization bias, and minimal methodological interferences in individual patients. Routine methods with tight long-term impression with CVs of less than 2% are recommended. A lower CV value provides a more precise result that leads to a more accurate diagnosis for diabetes. TOSO has CV less than 2% for all our GHB analyzers, namely the GX, G8, G11. What is HPLC? HPLC is high-performance liquid chromatography. The function of HPLC is to separate the HbA1c and other forms of hemoglobins based on their charges. The G11 ion exchange chromatography uses an HSI non-porous polymer resin to separate proteins according to their surface charges that provide excellent separation. When injected with sample blood, the hemoglobins attach to the negatively charged non-porous polymer resin inside the column. The elution buffer washes away the hemoglobins from the resin. More positively charged hemoglobins are removed as the ionic strength of the elution buffer increases. The hemoglobins are read by the detector and documented on a chromatogram. The result is an excellent separation of hemoglobins. The benefits of effective HbA1c monitoring are reduced healthcare cost, receding health complications, better patient follow-up, excelling clinical decisions, improved results consistency, upgraded laboratory efficiency. Measuring HbA1c using HPLC provides the most effective mechanism for monitoring the effectiveness of diabetes therapy.